this rainy Friday in November, we're talking about the month itself, and that is Men's Health Awareness. We were going to welcome back in Dr. Seth Hollenbach. He is a urologist with CHI St. Vincent in Hot Springs, talking about how important this month is. And the first thing we were just talking about was how I don't have a beard going. And like Seth, I probably should, but I can't grow one as well as you. Good to see you again, buddy.
Good to see you, too.
Yeah,
Good. Thanks for having me back.
You know, this is that month where you see a lot of guys. I mean, the Today Show's doing it. You see a bunch of people participating in Movember and No Shave November. This is a time of year.
Football,
NFL, yeah. A time of year where we all try to make sure we acknowledge men's health, something that I know as a urologist, you have to always press to get guys to come in and see their doctor.
Oh, man. You know, just because we're men, you know, we don't want to go to the doctor. We don't want to talk about our problems. But, man, there are some things you got to look out for. You know, you got to look out for, especially as we get older, like unfortunately we're both doing. But you got to look out for urinary problems, especially prostate cancer. That's the one that everybody is aware of.
Yeah, that gets the most publication, yeah. Absolutely.
Especially with our generation now, also quality of life problems, you know. Yeah. So you got to look out for all those things.
Now, when should a guy, or how often should a guy go see maybe a primary care physician, urologist, especially in what age group should a guy start going to see a urologist on a regular basis?
Right. So especially as, you know, as we're approaching 40, we tend to start having little problems occasionally.
Yeah.
I tell those guys once they start having a problem and it's bothersome to them, you know, they probably need to go see somebody.
Okay.
After they start being bothered by it, we can probably give them some help with those things.
Yeah.
And so everybody usually starts at the primary care doctor, and depending on the severity of their symptoms, they'll refer them over to the urologist, the specialist, to take care of those things.
All right. Some of the symptoms, obviously, trouble going, incontinence, but you know, just any kind of pains too. I mean, I feel like guys, we try to walk off the pain sometimes, or just think, oh, it'll be fine, we'll get rid of itself.
Rub some dirt on it.
Yeah,
man.
Yeah, exactly. That's not always the case. It could be serious sometimes.
That's right.
Yeah.
You better believe it. You know, most of the time, anytime we're having problems, everybody's like, oh man, I'm just getting older. It's my prostate. Don't worry about it. Well, you know, it might be, but then on the other side, the spirit of the month, you know, it might be prostate cancer. So, and you don't know until you go see somebody and have it looked at.
I know a lot of guys out there too are shocked to find that they have prostate cancer. I mean, it's something they don't think about. It's not on the forefront of their mind. I know that's something you guys are trying to get the word spread out.
Oh, that's right. You know, most of the time we see prostate cancer and they had something as simple as a lab test done at their primary care doctor, and they didn't have any symptoms whatsoever, and they come see me, and boom, I kind of shock them. You know, I tell them, but that's the reason to go. That's the reason to get checked out, and that's the reason to be looked at, because, you know, nowadays especially, you don't have symptoms with it.
Yeah.
And we can find it early, and early detection is the way to go.
That's the scary part. No symptoms.
Right.
Let's talk about quality of life issues. What are some of those that you typically see?
Yeah, quality of life, we take care of a lot of these nowadays, especially with the new generation, you know. Mainly erectile dysfunction. You see that on every football commercial during the Super Bowl, everything else.
There's a lot of them out there, a lot of options.
Yeah. You can't even watch TV without seeing some commercial about erectile dysfunction, testosterone, and then men's incontinence, especially after prostate cancer surgery and things like that.
There's a lot of different things out there that if you're a guy and you're wanting to get looked at, and really another thing, I'm sure you get this a lot too, guys saying, my wife made me come. So we would encourage, you know, wives, girlfriends, encourage them, right?
They need to come and need to participate in their spouse's health, and I can tell you, every single time a wife or spouse or somebody comes with them, they're going to do 1,000 times better because they got their coach, they got somebody with them, you know, telling them, hey, you got to do this.
Yeah, it's a team effort, right?
It is. It really is. So,
okay. Well, we appreciate you stopping by today.
All right, man. Thanks a lot.
All right, we do want to remind everybody about CHI St. Vincent Urology in Hot Springs. You can go to chistvincent.com. There's the address and the phone number. If you want to call ahead, write that phone number down right now. If you're experiencing any of the issues we just mentioned, make sure you make an appointment as soon as possible and go see your doctor. All right, Seth, we'll see you next time.
All right, man. Thanks a lot.
Thank you. Coming up